Hi, my name is Jeff, and I'm an occupational therapist who goes by the moniker OTDUDE, and I work in the hospital with patients such as those who have had a stroke. And so today I'll be going over kind of some do's and don'ts when it comes to exercises for the shoulder, and I'll be demonstrating how to do these. So the concept of no pain, no gain, I think does not apply, and this is kind of like bad advice to follow because pain is your body's way of telling you to kind of stop or to slow down. Now, soreness is kind of like if you exercised before, soreness isn't necessarily a bad thing. And I want to make a distinction between soreness, which is okay, and experiencing pain. So when it comes to the shoulder, it's kind of different than other kind of joints because, for example, with like my elbow, it kind of just does one thing, kind of like a hinge, door hinge joint, and it just kind of goes in one direction. With the shoulder, you can move in all sorts of directions, right? You can kind of do this, go up, down, forward, back, even reach overhead, reach behind, right? So this means that there can be a lot of motion, but if you're kind of forcing something into that high extreme motion without it initializing it and starting that movement by itself, you are prone to things like shoulder impingement, and that can cause further complications like pain and subluxations and things like that. So what you want to do is go slow and go easy and kind of go basically in small increments and ranges. What you want to avoid doing is like bringing your shoulder all the way up here. Even though you normally and naturally can do it, I think a good rule of thumb is just go about shoulder level. And another thing to avoid doing when doing shoulder exercises especially is to kind of pull on your finger or to pull on more further parts of your arm than the shoulder, right? Because you're working on the shoulder, if I'm like doing exercises like this, I'm pulling on my finger, and this can cause complications too and like further pain because I'm not feeling, like if I have numbness and I'm not feeling it, I may not necessarily notice that I'm injuring or making things worse. That's not to scare you guys, but basically my second tip is if when you're doing shoulder exercises, try and grab it yourself in your arm at the elbow. Because what I see when working with patients is that they tend to pull on their fingers when they're trying to work on the shoulders, and they have like finger pain or wrist pain that develops. Whereas if you're holding like your elbow, you have a much bigger bone right here, right? And it's less prone to injury, and you're more directly exercising the shoulder itself. So the first one I'm going to demonstrate is called rock the baby. And it's kind of what it sounds like. Basically, holding your elbow here, you bring your shoulder up to about here, higher the better. And if you have some pain, just kind of go within the pain-free positions. So if I have pain that starts about when I go up to here, I'm just going to go lower than that. And it's called rock the baby. So basically, ideally, you can bring it up to the main goal is to bring it around here. And you'll notice that I have my arm away from my body. I'm not doing it like this. I am bringing my elbow further out, away from my body, and then I'm going side to side. So I'm rocking the baby. Rock-a-bye baby. I don't know that song. But anyways, that's how you do rock the baby. Start slow, go slow, and respect your pain. And I'd say a good number to start, maybe, I like to count in even numbers. There's no wrong number of repetitions, but maybe do 10. And definitely don't overdo it. And then rest and then do maybe 10 again in the middle of the day, and then 10 in the evening or something like that. Don't go overboard and do like 100 or 200 because you're going to just overdo it. And that's going to put you into a slump, right? You're going to have like pain and like too much soreness. Then you're not going to want to do it the next day. The key is to gradually increase the amount of repetitions so that you can do more and more and tolerate more and more. And the goal of doing these types of exercises, what we call self range of motion exercises, is because, well, the left arm, for example, can't move, we're going to use the right arm to help bring it into the motion that it's supposed to be able to move, just that the muscles don't have like the signals from our brain to do those things. It's not to say that it lost its strength or it's lost its like flexibility. It can still do it. So that's why doing these exercises are okay. Now, the second exercise, which I will call the table stretch, is basically the third of the motions that your shoulder typically can do. So besides going forward into flexion and outward into abduction, it's the third one called external rotation. When that looks like is basically me bringing my shoulder and my hand, if you like follow it, like its motion and its arc, it moves towards the outside externally from and away from my body versus internal rotation, which is internal and closer to my body. And you may have noticed yourself too, after a stroke, your body kind of goes into this kind of fixed posture and close to your body, especially like immediately after a stroke, your body kind of goes into this. So what we're doing is we're countering it by doing the rock the baby and bringing your hand out and doing this external rotation. Now, that's going to be really hard to do because your hand moves away from your body, right? So what we're going to do is we're going to use an external support. Now, typically you're going to be doing these exercises either like sitting down or like sitting up in bed. You may have like a tray table, a table like I do have beside me, or an armrest. So now I'm going to kind of switch sides and make it so that my right arm is the affected side after the stroke because there's a table beside me. So what I'm going to do is basically avoid grabbing at my fingertips and placing my arm on the table. What I want to do is place my elbow on the table the same way I hold it with Rock the Baby. And I'm going to flip it so that I use my left hand now to support myself. If my right hand was unsupported on my right side, it'll probably look something like this, right? I'm going to reach and grab my right elbow and gently place it onto the table. So now you'll notice that my right shoulder is actually more kind of in line with my left versus before, and maybe kind of like lower down because gravity is naturally pulling on my shoulder. So what I'm going to do is grab my elbow and gently place it onto the table now. And you can even actually rest the whole hand onto the table. And this is going to be good for it because it's a nice stretch. And what you basically do is just turn away from your right arm. I'm on a turning chair, like office chair, but if you can't do it using the chair, you can just naturally turn your body. So I'm going to do it that way so everybody can do it. And turn away from it. Now to exaggerate it, I'm going to turn my chair as well. And this goes into an external stretch for the shoulder. And just go into what you think is comfortable. And just hold it for, I don't know, 20, 30 seconds. If you can go to like a minute, that'd be good too. And then you can go back into normal position and do it again. And this helps to maintain that external rotation for your shoulder. And hopefully you regain some function in your arm. And the ultimate goal is that you don't need to use your helper hand to do these exercises. The ultimate goal in your recovery is that you'll one day start to see some movement into your shoulder so that you can do these exact same movements without the other helper hand. So for Rock the Baby, it'd be like bringing your arm up like this or out to the side. So those are the top two exercises that I recommend and I usually use with my patients and have them do on their own, the Rock the Baby and the table external stretch. So give these two a try and let me know how they go.